Polykinesiology session 7 continues with an AK perspective on blood pressure. So in short, just a quick review here, blood pressure equals cardiac output times peripheral resistance plus total volume of fluid. Cardiac output is equal to stroke volume times heart rate. So how much the heart contracts and how often. Blood pressure, a traditional look for many decades of what was appropriate blood pressure was from Guyton, several versions back, states that systolic blood pressure should be equal to 100 plus the patient's age, roughly. Diastolic should be at or below 90. This accounts for the tendency for patients' blood pressure to go up at a steady, slow rate as they get older. Currently today, though, most allopathic physicians insist that systolic should be below 140 and diastolic should be below 90 regardless of age. Current cholesterol recommendations, just a little bit of a side, these are the current cholesterol recommendations, and that's that your total cholesterol should be below 200. We could talk a lot more on that, but so some rules of thumb with evaluating blood pressure. Ideally, we should take blood pressure in both arms. We should also take it seated, standing, and supine. It's really more of a functional look at how blood pressure is adjusting to different positions. Also, blood pressure can be different from one side of the body to the other, and this could have to do with a number of things that can be often corrected structurally. Dural torque, for example, cranial problems can result in an asymmetrical neurological conversation on each side. And of course, going back to adrenal testing our adrenal patients, a positive Ragland's test is when the blood pressure drops from seated to standing, even dropping or staying the same. If blood pressure increases when the patient lies down, suspect a kidney problem. You want to check kidney-related muscles and check into their history and current symptoms. Maybe look at their labs. So the nervous system is managing blood pressure short term, moment by moment. The hormonal system is what adjusts to maintain more of a long-term control. Aldosterone is a key element, one of the adrenal cortex hormones. Aldosterone is responsible for the kidneys to resorb sodium to pull water back into the blood. So then also the renin-angiotensin system. Renin is like the dormant version, and then it's converted to angiotensin, which is a vasoconstrictor. And then, of course, there's the antidiuretic hormone, vasopressin, and most of the drugs used for blood pressure are aimed at one of these mechanisms. They give diuretics, they give beta blockers, and then they got a whole host of other things. Basically, they're working on getting the heart to contract less intensely. So beta blockers basically lower the heart muscle's ability to respond to epinephrine. And then they try to bring fluid levels down to decrease the volume of fluid in the blood. This is the various classes of blood pressure medications that are used. Diuretics, beta blockers, ACE inhibitors are the ones I see the most commonly in my practice with patients coming in. I have a lot of patients on blood pressure medication, and it's very challenging for me because they'll be put on these medications just at the drop of a hat. They go in, they have a 1 or 2 high blood pressure readings on a routine exam, and if they're older, male, if they can get put on a medication with very little evaluation of what's really going on with them. This is happening all the time, something we really have to watch. And it's very difficult for me as a chiropractor in Oregon. I'm unable to alter people's medications. So as naturopaths, many of you will have a much more expanded access to these patients and a much more expanded ability to manage these medications and hopefully get people onto something that's maybe a little more sustainable, or maybe a lot more sustainable. So, of course, if we suspect kidney issues, we look at the psoas, and these are some standard process kind of classes that have been used for to test a weak psoas on if you suspect kidney issues. And then, of course, we want to look at the adrenals, specifically the adrenal medulla hormones. So you've got the adrenergic and the cholinergic hormones that you can check different nutrients on. I don't do a ton of this, but often I'm more prone to use adrenal adaptogens when I suspect that they've got a adrenal medulla issue. So one of the places we get access using applied kinesiology is the carotid sinus. This often will, if a person is having blood pressure issues that is actually causing stress to their body, this area can often therapy localizes very well, and we can do 2-point TL to the various other organs, of course, adrenals, thyroid, emotions, liver, kidney, and then also we can also look at possibly how allergies are affecting blood pressure as well. It's hard to look at blood pressure without looking at blood sugar, without looking at adrenal function, without looking at emotions, and certainly the immune system. So here's another list of nutrients to consider. Down at the bottom there is oral chelators. Captomer is one Dr. Francis I know liked to use a lot. Remember Cataplex G, and of course in the biotics line, the GGGB or triple GB B vitamin complex are going to promote more relaxation. Magnesium is very important. Of course, the omega-3s and 6s are very good at keeping the blood viscosity, the right thickness. High fats. The big deal in diets around blood pressure is the fats and of course salt. Certainly if we're not digesting our fats, we're absorbing them properly, they're going to be a problem. They're going to create a lot of issues in the blood. So it's very important to look at how the body is tolerating fats. We want to look at gallbladder function, liver function. So that takes us back into other branches of our AK exam. And then we want to especially look at protein. How is protein being broken down in the stomach? We're going to talk a little more about that in the next, when we talk about allergies. But protein 80% of protein digestion occurs in the stomach. And that is if there is an appropriate amount and pH of hydrochloric acid to trigger the pepsinogen into pepsin. And of course, blood sugar is very important because cortisol has erratic cortisol profiles, and excessive cortisol in the blood will cause stress on the nervous system, which can cause erratic blood pressure as well. Some other things to consider. We talked about the glabellar fault in another session, and I found this extremely successful over the years. Not necessarily long term, unless you can identify why they ended up with the glabellar fault. But the glabellar fault is when you have bilaterally tight temporalis muscles, which causes basically kind of a restriction of the cranium being able to move properly. I've been able to drop blood pressure in my office 10 to 15, sometimes more systolic points doing a glabellar, and I've done it many, many times, mainly because I do CDL physicals, and if a CDL, those are certified driver's license physicals, so if they come in and their blood pressure is 140 or 150, I'm not authorized to certify them if because the feds set the limit at 140. So if they're say 140, 150, 155, I will do a quick glabellar fault cranial adjustment on them and retest. And a lot of times I can get them down well below 140 so that they can pass their physical. But then of course they get my lecture about excessive caffeine and sugar and alcohol and smoking and all those things. But they're very happy to sit there and listen to me because I just saved them a whole lot of trouble by but anyway, so there's a list of homeopathics that have been found to be very helpful there for your reference. And of course, you may have a whole other list of things that are worth testing on the patient using AK. Of course, you can test them using the carotid sinus. You can test them using heart alarm point. You can test them against, say, a weak subscapularis. So low blood pressure, a lot of times that's your hypoadrenic patient. And you want to look at nutrition that is going to tone and support toning in the body. So B6, things like that. Also, you always want to make sure you check for dehydration. There's a column here, the Cataplex B is standard process, Vasculen. The two products I use quite a bit from Biotics are 3BG, which is kind of heavier on the toning group of the B vitamins, and then of course ADHS I find very helpful. ADHS has a complement of B vitamins and some herbal components that act as adaptogens and also help to bring the overall energy system up in the body. Congestive heart failure, pitting edema. These are patients that can be very challenging. Dr. Francis, I think this is from his notes, Cardio Plus 1 per hour. If somebody comes in and they're clearly in congestive heart failure, they're showing breathing difficulties, pitting edema, maybe erratic blood pressure. You check it and it's like spiking up to like 180, 190, and then drops down to like 130. These are usually conditions I'm not going to treat in my office. They're just the kind of practice I have. But you can treat them for other things, but if they have pitting edema and difficulty breathing, they probably are going to need some more immediate and dramatic care. Mitral valve prolapse, I would say, short of, that's a pretty intense diagnosis, but I would say in general, think of the heart as a muscle, because it is, and it's going to be subjected to the same challenges as any other muscle, if there's B vitamin deficiencies, magnesium deficiencies, things like that. So the heart needs to be able to make its own energy to contract, 24/7. Another issue that comes up a lot in functional medicine is hyperhomocysteemia. And this is a very toxic substance that's created by our body, but normally detoxified. It says check a strong muscle with homocysteine on the tongue. I don't do that. I have homeopathic preparations of homocysteine that I will use to do energetic testing, which is a little bit outside of what we consider mainstream accepted practice in AK, in the ICAK. But you can also, whenever you order blood work, you want to get a homocysteine reading, especially if this person's at risk. Some of the nutrients to look at, you find a weak muscle, especially a subscapularis muscle, test them on folic acid B12. Check them on, the regular versions, and also the methylated versions. B6 niacinamide. Lecithin, I haven't used that. Nitric oxide, another thing that's really worth talking about with heart problems. Nitric oxide, there's some really interesting stuff out there, articles on this, and some neat studies that have been done. But nitric oxide is a neurotransmitter that is responsible for relaxing the endothelial lining, which helps, which is involved in vasodilation and sort of counteracting high blood pressure. Nitric oxide is sort of everywhere in the body, and it's secreted by the intimal linings of the blood vessels. It's also secreted from the mucosal linings of the sinuses. One of the things that produces more nitric oxide in the body is rhythmic, focused nasal breathing. Like yoga breath exercises will help bring the nitric oxide levels up, and it's believed that's one of the main reasons that pranayama, or yoga breathing, has such a powerful effect on relaxing the body, and lowering blood pressure. So the kind of things you would suspect with nitric oxide, in short, is, of course, blood pressure issues, immune issues, impotency, according to this slide, just in general, signs of a person who is really in a sustained stress state. So this was an interesting article you can look up. It talks about yoga, pranayama breathing, and it's really important when I teach people these breathing exercises that they breathe in and out through the nose. It's amazing how, and I would say the majority of people that I teach how to do yoga breathing, they breathe in through their nose and out through their mouth. And so I have to kind of reorient them that way. I say you need to breathe in and out through the nose because the sinuses are designed to filter, warm, and ionize the air. So the air comes into contact with a lot more surface area in the sinuses in and out than if you breathe in through the back of the throat. Now, obviously, if you're exercising, you're going to need to bring in air through the nose and the mouth, ideally. So the next clip is going to be on allergies, the AK approach to allergies.